Dr. Vishnuvardhan, consultant nephrologist at Manipal Hospital Whitefield. So kidney is a very tricky organ which is both good and bad actually. Till kidney is 90% damaged, it won't give you any symptoms. That is the worst part of kidney, because suddenly we will come to know about the kidney problem when it is in advanced stage. But good thing is that body can sustain till 90% of kidney is damaged. That is a good thing about that one. So depending on early symptoms is not a great thing, but still I will go through the early symptoms of kidney CKD. Early symptoms are loss of appetite, weakness, abdominal cramps, loss of sleep, passing more urine at night, and leg swelling. These are the early symptoms of CKD. But my fine advice to you is, please don't rely on early symptoms of CKD. It is hidden in your body. Best is to go through the health check and get to know about the kidney disease. The main cause is diabetes, because around 50 to 60% of kidney CKD is due to diabetes mellitus. This is the biggest contributing factor for CKD. Next most important factor for CKD is systemic hypertension. This will attribute to another 10 to 20% of cases. These are the two things, diabetes and systemic hypertension, which are under our control, which we can diagnose early and treat ourselves. The other causes are glomerulonephritis, which we don't have any hold on that one, which can happen in any person. So that is the third most common cause. Next common causes are the ureteric and stones and the kidney infections. These are the fourth most common causes. And remaining are the rare genetic conditions, or kids or babies which are born with congenital abnormalities. So to count all the things, the causes of kidney CKD are diabetes mellitus, systemic hypertension, glomerulonephritis, kidney infection and stones, and the congenital abnormalities. Basically, we rely on very few tests are required for diagnosis of CKD. These are all basic tests. That's why we advise you to go through this test as a part of the health check, so that you are diagnosed at the earliest. So basic first thing what we require is serum creatinine. So we want to know whether your kidney function is normal or it's decreased, that we want to know. Next we want to know, is there any proteinuria or is there any blood in urine, that we want to know. And this is again a simple test we need, like urine routine microscopy and urine protein creatinine ratio. In diabetes, we might require urine microalbumin creatinine ratio for early diagnosis. And next thing we want to know is the kidney size, whether your kidney size is normal or it is increased or it is decreased. These are the three most common thing which is required for us to diagnose whether you have CKD or not. If these three things are normal, then almost CKD is not there. So I will discuss with respect to diabetes and other conditions. First is diabetes. Moment you are diagnosed with type 2 diabetes mellitus, please consult a doctor, so that let him screen you for any kidney disease, whether it has happened to you or not. Let him check it at it. If things are fine, if you don't have kidney disease due to diabetes, then you can yearly once screen yourself and consult doctor if it is required. Otherwise, meet doctor at least once in 3 to 4 years to have a look at what is there in the kidney, if you are a diabetic. If you are hypertensive also, first time please consult a nephrologist, have a look at the kidney, whether is there any kidney involvement is there or not. Then if it is not there, then you can yourself screen once in a year, or meet a general practitioner and keep screening once in a year or once in a 2 year. If anything, if they suggest, general practitioner, if they suggest anything, then if you are found to have proteinuria or any other things in urine, or if there is any decrease in kidney function, then you have to immediately consult nephrologist. In cases of kidney stones, usually people present with have blood in urine or abdominal pain. In that time, we will please consult the nephrologist and also urologist and we can diagnose further things based on that one. So basically our intention is, please visit in the early phase of your disease so that we can contribute significantly to you. First is diagnosis. We want to know what has caused the CKD. If you are a diabetic, I want to know whether this kidney issue is due to diabetes or it's due to some other cause. So usually we do kidney function test, urine routine microscopy, urine protein creatinine ratio, and fundoscopy. Fundoscopy is one of the most important part of diagnosis, because if eye changes are there due to diabetes, then there is a high probability that your kidney disease is due to diabetes. So if any person comes with diabetes to us, then we want to know whether your kidney disease is due to diabetes or it is not due to diabetes. And common protocols are that we want you to have basic things. One is the urine protein creatinine ratio, kidney function test, ultrasound to know your kidney sizes are normal or decreased in size, and other tests based on the individual condition. If you are found to have disease such as glomerulonephritis, if your reports are suggesting that there is a primary kidney disease like glomerulonephritis, then we usually advise kidney biopsy. Kidney biopsy will help us to know particular disease about the kidney, and that will help us to do the final diagnosis, and medications will depend on the final diagnosis. If we find anything in the ultrasound, for example stone or distended bladder or prostatomegaly or any other cyst or any other thing, then we will work up according to the condition.